My name is Charles Triay. I'm a GP with numerous years of experience in addictive disease. So with C Recovery, we try and offer a global assessment initially when the patient arrives, which is fairly complex because it has to consist of a number of different aspects. But probably the most important aspect is the physical assessment of the patient, because we need to decide if the patient is going to have to come into a hospital, an inpatient facility, to give them a sort of 24-hour medical cover for the first few days to make certain that the detox or the detoxification of alcohol or any other substances is safe. That's the initial and the most important decision to be taken. In the vast majority of cases, patients do not need initial hospital facilities. So we assess their medical situation in terms of what substances they've been using, how much, how frequently, and when was the last time that they used them, so that we can judge whether they're going to need any additional medication for the first few days just to help them into the program, or whether they can just simply start therapy straight away without any medication. In order to get there, we need to also have assessed their previous medical history. Addictive disease is now closely associated with other mental health conditions. So we need to take a sort of fairly detailed medical history. For example, a lot of patients might be suffering or have suffered from depression, generalized anxiety disorder, and even other conditions such as ADHD or previous trauma. That means post-traumatic stress disorder. And that becomes an important clue right at the beginning of their treatment, so that the therapeutic team and the psychiatrist can then follow on from there and try and fine-tune how they're going to actually institute the best individualized plan for that patient. In addition to that, clearly we need to take into account previous medical history in terms of physical conditions. So very often we've got a situation with hypertension, diabetes, asthma, all these other conditions need to be identified right at the beginning, so that we make certain that their medical care is safe right from the onset. As part of that process, we will do a general physical examination, and indeed at the same time we will run a blood screen that will check for liver disease, kidney disease, pancreatic conditions, situations again that we need to identify, that will help us identify the severity of the damage that the patient might have done to himself by abusing certain substances. And similarly, we might have to do an electrocardiogram, particularly with patients that have abused stimulants like cocaine, to make sure that, that there isn't any significant heart disease. So that inevitably takes a bit of time. We then prepare a report which goes to the therapeutic team and to the nursing team at C. Normally a few days later, once I've received the blood results and once we've, if you like, completed the initial sort of few days of treatment, we will do a follow-up consultation, often on the phone, depending on how the patient is doing. But if the patient is doing well, it'll often be a telephone consultation. Just to give the patient some feedback on what their blood results are, for me to get the feedback on how they've progressed these few days, and really just to sort of put them on track with to be monitored by the therapeutic team and by the psychiatrist. It is true that sometimes we have other conditions that manifest themselves whilst the patient is in C. They may develop a chest infection, they may develop other conditions that will require treatment. So I will usually then just supervise the more medical, physical aspects of their problems whilst they're at C recovery, and coordinate with the therapeutic team and the psychiatrist in order that we can offer a sort of coordinated package for patient care. And in terms of the mental health care, I will coordinate directly with the psychiatrist in order to try and reduce or increase certain medications that I might be needing for the physical care of the patient, but that may be having an impact on the mental health care and the mental status of the patient. So the coordination is either it's always in writing so that we have written instructions, but certainly through messaging and telephone calls on a regular basis with the rest of the team.